Hi everyone, Christelle Zimmerman here, founder of ZimpleLiving.com, and I'm here today to talk to you about something really exciting. Many of you know that I am a wellness advocate with doTERRA essential oils, and I had the opportunity to go to Utah last week to our corporate office, and lo and behold, right across the parking lot there is our brand new health clinic. It's called Prime Meridian. So today I just want to take you with me. Come on, let's take a little peek inside where you can see how healthcare is going to be delivered, and Prime Meridian being the 0 point in time that everything else comes after this. I have a feeling a lot of people are going to copy this model. So come on and take a look. Let me share my screen and I'll take you inside. Okay, here we go. All right, so let's just move inside and see what we're going to find. One of the things that I noticed when I walked right inside the door was how gorgeous the light was coming in. You can see these butterflies and just how beautiful the sun is. And could you imagine in the wintertime, just being able to see the snow-capped mountains outside, just being able to bring nature inside. So this is just a view of the lobby as you walk in the door, and I have a real treat for you in 1 second here. More of the gorgeous stained glass butterflies, and a lot of the stained glass is also in the corporate office as well. It's just beautiful how it's bringing nature inside, and every detail is just meticulous, so meticulous. So this is Dr. Brannick Riggs. He is the Healthcare Initiative Vice President at doTERRA, and actually the one who is behind all of Prime Meridian. And it's so exciting to hear him talk. So I'm going to stop talking and allow him to talk here so y'all can hear him, okay?
So the idea for this building is that one of the places that people heal the best is in nature. It's not in buildings or hospitals. So this is Utah. It's really hard to build an outdoor clinic because we get things like snow and rain here, and that wouldn't be very fun for you to come in and have an exam while it's snowing and raining. So we thought, let's see what we can do to bring nature inside. So you'll see lots of natural elements within this space. So our butterflies obviously are kind of the most obvious ones in here. This is by Tom Holman, created these for us. And they're between 1 foot and 3 feet as far as the wings are concerned. So that's kind of a fun place. And there's the same guy that did the lamps over in our corporate offices that you'll see here after this one. Or is this your last one? This is your last one. You've seen those lights over there. You'll see lots of stone in this facility. You'll see water. We try to bring all of those elements, lots of natural wood as much as we can. You'll notice next to our exam rooms, there's pictures of flowers and plants. All of those are pictures of plants that we source our oils from. So it's pretty exciting. Oh, finally had a group to the elevator. Pretty boring up there, isn't it? There's not a lot going on. That's kind of the elements that you'll see here. Because again, we're trying to bring nature inside. You'll see even in our waiting room here in our lobby that the floor, the carpet looks like a little bit like granite from the Wasatch Mountains here. And even on the carpet, you'll see these blotches of green, which is the lichen that grows naturally on our rock. So pretty exciting. We are a membership-based clinic, which means that we don't take insurance. We don't care whether you have it or don't have it. To us, it doesn't matter. You're paying a monthly fee, and with that monthly fee, you get 24/7 access to your provider. You get 30 to 60-minute visits. Yes, you heard that right. You can have a shorter than 30-minute visit. Because real medicine takes real time. And 5 to 10 minutes in a visit, which is typical in primary care nowadays, really can help you get to the root of your challenges and get you better. More importantly, it can't develop a relationship with you to identify what are the things that you don't know about right now that you're at risk for. So I get the question all the time from wellness advocates, I don't ever go see a doctor, so why would I need to belong to a Prime Meridian clinic? Well, what better time to go see a doctor is when you're well. Let's figure out how to keep you well. We all currently at this moment are dying of something. We just don't know what it is. Whether or not you have a genetic risk for colon cancer, breast cancer, cardiovascular disease, all those things that you may not know about. Your doctor may have said, your cholesterol's fine, don't worry about it, you're doing great. But at the end of the day, if you have certain genetic risk factors, your cholesterol needs to be even lower. And they have never taken the time to dive into that. So we here would love to see well patients so that we don't have to see you when you're sick. so that we're not treating you for a heart attack at 52. And the way to find that out is now while you're doing just fine, so that we can avoid that over the long term. So that's kind of what we're doing here. Let's move into the lobby here, and we'll talk here a little bit about our.
How does that sound, you guys? 30 to 60 minute health visits, because real medicine takes time. How awesome is that? That just really struck me. All right, so we all moved into, you could see some people got stuck in the elevator. We all are upstairs. We all moved into the room right past the lobby, which is the waiting room. And this is where all of the patients will come, and you can see Dr. Riggs standing here in front of the window. So the lighting's not terribly great, but I do want to show you what happens in this waiting area, especially with your littles when you bring your littles. All right?
Pediatric area over here. Yes, I have spent time playing those games. Just so you know. Right, I know, it's hard. They draw you in. But one of the challenges with pediatric offices is that they have lots of toys to entertain kids in the waiting room. First of all, you don't spend much time in a waiting room here. You come in, we notify the doc, they can get you in, you're out of here. But when you do have to spend some time here, toys are notorious for spreading disease. So you'd hate for your kid to come in for a well child check and leave sick because they picked up the stuff that the previous sick child was in here for. So we don't have toys in our area here. We have a mat down there that they can play games on, but it's just with their feet, right? So they can do that. The other thing that we do differently here is we want to create a sense of community for health and wellness. And really, when you go to your doctor, you don't have that opportunity to meet with other folks and to really learn how to develop a wellness lifestyle. So when your doctor wants you to change your diet, change your exercise, what he does is he says, hey, you need to change your diet and exercise. I gotta go, we'll see you later. And he leaves. And you're left going, what the heck, what am I supposed to do? Well here, number one, we have 30 to 60 minutes to really dive into that. But number two, we create a sense of community. So you can see right behind me here, this is our clinic garden. We, the clinic members, work this garden. And then we teach gardening classes. We teach you how to grow your own fruits and vegetables, how to eat organically. We have a cooking class, the white table out there, we just had a cooking class this morning, where you can come and you can learn from a dietitian or a chef how to eat better. Pardon me. How to eat better, how to cook better. You can walk away from those classes with recipes. If you're a keto person, you walk away with a keto recipe. If you're a vegan or a vegetarian, you walk away with a vegetarian recipe. Etc. So you'll walk away knowing more about how to do this. We take our patients shopping to the grocery store. It's as simple as things like that when you go to the grocery store and your doctor said change your lifestyle, you're like, I don't really know how that's supposed to change how I shop. Well, let's teach you how to shop the outskirts of the store. And if you do need to go into the middle of the store to get something, how to read a label, to really understand what it is that you're putting in your body and how that's going to affect your system. So we really walk people through that process. We're developing things like meditation classes, yoga classes, so that we can help reduce stress. We know that those things affect health. Those are things that traditionally you do not find in your primary care office. But here, we want to walk you through. So our providers are living the same lifestyle that we're trying to tell our patients to be living. You'll see them at those events. We do a once-a-month hike with our patients. So that on a Saturday morning, you can show up with you, your spouse, your kids, and you can walk with the providers. Talk about whatever you want to. We want to get to know you. We do a walk with the doc at lunchtime, so that once a week or twice a month, you can have time with your physician outside of the clinician's office. It's really a concept called care outside of the walls. So it's a different concept for medical care than it is traditional. Okay, let's go back down this hallway.
So how does that sound to you guys? Care outside of the walls and just that sense of community. I think that's what many of us are here for. The oils are what drew us in, but it's just that sense of community that we get to do this with one another that keeps us here. So this sounds super exciting to me. I couldn't even imagine having someone come to the grocery store with me and help me shop, but that's where we're going with this. What happens to be on that actual clinic visit. So incredible, right? Incredible stuff. All right, so now we're walking down the hall. This is two separate pictures here. we're walking down where there's exam rooms and consult rooms. And believe it or not, sometimes you will go to the doctor and not have an exam. If you have a follow-up visit or something like that, imagine you don't have to put on that little robe, the little open to the front. Okay, so how cool is that, that you just get to have time with your doctor? Now, these are the pictures that Dr. Riggs said, these are coming straight from the plants that we source. How beautiful is that, that we've blown that up and they put that on the wall there. So let's keep walking. This is just a brief cutout of us walking down the hall and then of the reception area. So I'll show you that. Just the exam rooms, the consult room, very private. And then here's the open fishbowl of where you're going to have the staff, the doctors coming and going. So just really open. And now let's move into, let me move the photo here. What makes Prime Meridian different than any other delivery of healthcare? And like I said earlier, this is going to pave the way for how healthcare is done. You guys remember 30 years ago, HMOs came on the scene and everybody thought, oh my gosh, what on earth? Nobody's ever going to do that, because we went from 1 hour doctor visits way, way back when I was a kid to these turn-em and burn-ems. And then now we're getting back to, right, we're the pioneers at Prime Meridian, getting back to those 1 hour doctor visits because they want to put us first and we're the boss of our own healthcare. Like, that is just the coolest thing ever. So let's listen to the question of what makes Prime Meridian different. And again, Dr. Riggs is going to answer this for us.
One of the things that you'll notice about our clinic is a little bit different. In a traditional clinic, the physician is hopping from room to room to room. And the reason is we have to see about 24 to 30 patients a day to keep the lights on and pay all our staff and take them a paycheck and all of those things. And here we don't do that. Here our patient panels are limited to about 800 as compared to 4,500, which is the practice that I left. So here, again, a 30 to 60 minute visit, we can see anywhere between 6 and 12 patients a day is all we can see, and we don't go beyond that. So we don't participate in what we in the field call the churn and burn model, right? It doesn't make sense, and you can't really deliver good care there. So here, our exam rooms are a little bit different. You'll come into the doctor's office. This is where we sit and do our work. You'll come in there, you'll sit comfortably on chairs, we'll sit knee to knee, we'll talk about what we need to talk about for the day, we'll figure out what's going on, and we can ask questions that are different than you'll get asked in a traditional office. What are your stressors in life? What's your sleep schedule like? What's your diet like? What are the things that you're consuming that are that are countering what we're trying to do for your health, right? And then if we need to do an exam, if there's something going on that we need to examine, then we can move you to an exam. So I was telling another group that a couple months ago I'm seeing a patient in follow-up. They get in for a well adult visit. We've done labs on them. They were back a week later, and I was counseling them about their labs, and just out of reflex, I said, hop up on the exam table, let's do an exam. Then the thought occurred to me, why? Why am I doing an exam? Nothing's changed. They're not in for something new that's going on. So I realized the only reason I did it is because traditionally to bill an insurance, I have to do an exam. That's part of my routine is to do that. And in this model, we don't have to do that because the boss is you as the patient, not the insurance company. I don't have to do anything to make them happy. My job is to make you happy, and my job is to make you well and keep you well. One of the things, I don't know if I've talked about it in this group, the wellness issue. So many wellness advocates are well already. And they go, I don't ever go see a doctor. Well, that's the time to go see a doctor, particularly in this model, because we can really help you develop a lifestyle that will prevent you later on from getting the things that you're at risk for getting. Your doctor doesn't know what those are. He's waiting for the wheels to fall off the wagon to treat you. We don't do that. We would like to help you develop a lifestyle that causes those wheels to stay on the wagon for as long as we possibly can. And there are people that are living well into their 90s and even early 100s that have a great lifestyle, have their whole life, and are doing well. It's pretty rare now, and we hope to change that. We think that at this clinic we can do it. Now, some of the things that are exciting that's going on here, and I have not told any other group here. In this clinic, we have reversed type 2 diabetes, which is amazing. We get people off of all sorts of medications with what we're doing here. It's just very different than your traditional office. So we're pretty excited about this. We think that this is a novel idea. We think we are the first company of many to follow that will copycat what we're doing. We are Prime Meridian, right? Which means that all time is based upon what the time is at Prime Meridian. That is time zero. We can see in the future what will happen is we'll have many companies that say, we need to do what they're doing. We're going to set our healthcare system based upon what we see at Prime Meridian. So we're excited about that. We think this is a great concept, and we think this is going to take off. So I'm going to take like 3 questions. I know you were supposed to leave at 1:30 to go back up the hill. It is.
All right, so there's some other questions that Dr. Riggs is going to answer. And let me show you first what the room looks like. I wish this was a panoramic, but it's not. It's actually 2 different shots. So on the right, what you have is, this is one big room. I just got it in 2 shots. But on the right of this, what you can see is a normal exam table, what you'd likely find in a doctor's office. On the left, though, is where the doctor actually works. You can see there's a desk area. There's a spot where you can sit with the doctor. And I don't know if you picked it up, but where Dr. Riggs said, we can sit knee to knee. We're going to sit knee to knee, right? And isn't that the favorite way, that belly to belly, knee to knee, so that we can have time and actually get our questions answered, our health concerns dealt with, and have a plan, a real plan when we walk out the door, to make sure that we put these things into action and we just don't go away frustrated and have labs and come back and, oh my gosh, what does this bleak outlook look like? No, we're actually going to have a plan for the future, and they're going to follow up with us and continue to walk this road with us. So I think that is the coolest thing. And just looking at this beautiful room, it doesn't look like the usual, right, with the pink walls and it's about this tiny, and here's the cup that you pee in. They probably have those cups, but look at this, you guys. Don't you want to sit in a room like this where it just feels so much more comfortable? And I mean, just being able to talk to the doctor freely like that, I think is amazing. So let's move on to the next slide. And one of the questions that was asked was, how will essential oils play into this new model? So let's hear Dr. Riggs answer that question for us.
How will essential oils play into
So we talk about essential oils at every visit, and this will be open to the public. So for instance, our St. George clinic, it's been open since October. 50% of their patients are wellness advocates. The other 50% of the general public that know nothing about oil. So as they come in and they are recommended, hey, I would recommend this oil for you, it might be helpful. We don't sell oils in our clinic. None of our providers sell oils in our clinic. We do have samples, which is kind of cool. It's a 2.5 ml fill of various oils that we can give the patient. And we can say, try this. If it works for you, contact the wellness advocate. We give them a little card. They can either contact whoever referred them to the clinic, which is what we hope will happen, is that you guys refer folks to come in. If they don't know of anyone, if they walked it off the street, it'll have the number for doTERRA. They'll call into doTERRA and we put the orphan pool. And the orphan pool, from what I understand, is significantly shrunk down, where you're not getting some baby in Tallahassee and Los Angeles. So it's now supposedly it's by MSA. So, okay.
Did you guys catch that? 50% of the people that walk into these clinics don't even know about essential oils. And that's where we as wellness advocates come in. We have a big job, you guys, and that is to receive the people who are looking for an alternative to whatever frustrating road they've been on. They're actually looking for us. And when the doctor pairs with them and gives them a plan, they're going to be seeking out wellness advocates to get these oils. You heard that they're not going to sell essential oils through Prime Meridian. So super important now to just make sure that we're talking about the oils, using the oils, and we are really changing the face of what healthcare looks like and the accessibility of being able to handle a lot of life's little emergencies just in your cabinet here, even our basic kit, you guys. And it's encouraging to hear that the little sample vials what does that remind you of? That's when you go to the doctor and they send you home with a sample. That doesn't happen all the time, right? And then you've got to go pay your copay and all that. But this, they're going to send you home with a sample to tide you over until you can get hooked up with the real thing, the ongoing thing. I shouldn't say the real thing, because the real thing is in that sample bottle. But I just think that is the coolest thing, to be able to send them home with something and say, we care about you and we're going to connect you to someone who can continue helping you with these oils, along with this individual, the doctor at Prime Meridian. So it takes a village, right? It takes a village. So I bet you guys are all wondering now, how much does this cost? That was a question that was on my mind, because even as someone here in California that I do have health insurance, I don't love the way that it is delivered, or the way, the red tape that I have to go through. So even me here is thinking about being a part of Prime Meridian, and you're going to hear why the cost, it's very low, and the access that you get to is completely worth it. It's pennies on the dollar, you guys. So let's hear Dr. Riggs answer that. How much does this membership, it's not health insurance, they don't bill anyone, how much does the membership cost? All right, so here we go. Oh, sorry about that. Let's go back one. There it is.
Good question. Can't believe I didn't cover that. So I see lots of cell phones up. I will tell you this, it's about the cost of what you pay for your cell phone every month. So we're at $89 a month is your membership. That gets you 24/7 access to your doctor. That gets you telemedicine visits. It gets you phone visits. It gets you 30 to 60-minute visits in clinic. I love this. I have 5 kids, so you know I'm kind of used to it. It gets you, it gets you full access to providers. So it's kind of like having a best friend who's a doc that you always call and go, hey, I got this going on. What do you think, right? You have that through this membership model. So it's $89 a month for you. It's $69 a month if you bring your spouse. It's $20 per child up to 2 children, and after that, it's $15 per child. So, yeah.
All right, so let's move on to the last 2 questions here. One of them, if you go to the clinic, and I had an opportunity to tour it, but if I had been a patient and then come back home to California, I could still be part of the telemedicine delivery so that I could continue talking to my doctor over a video call. So listen to how that's delivered and who can have access to that.
Okay. So that's another question that came up. And then we'll get to your question, and I promise will be the last one. So physicians are licensed by state, which means we really don't have a license to treat across state lines. So if you were to come to this clinic and live out of state, when you go home, we can, by phone or video conferencing, treat anything that we talked about at your visit here. That's not a problem. We can do all the follow-up we want. If something new were to happen, you would have to come back for us to legally be able to address it, because we can't cross state lines. That makes sense? Understand.
Okay, so how does that sound? So far, so good, right? We're affordable, we're accessible. We can talk to our doctor, like you said, like a best friend anytime. And the last question is one that might be on your mind as well. What kind of training do the doctors get in terms of essential oils? They're doing more than essential oils here at Prime Meridian. I don't want y'all to think that that's the only thing that they're doing. They're approaching healthcare, the entire body, from every angle possible. You heard him in the beginning. So this begs the question, will doctors that work here, these are MDs, how are they going to be trained in essential oils? And are they going to be trained in essential oils? So let's listen to the answer to that.
It's a really good question. So here's what I'll ask. If anybody knows of that school where we can send doctors to, we're going to love it. Thank you. Thank you. The challenge is that most of us are traditionally trained. We're looking for MDs and DOs, right? And most of us are traditionally trained, and we got 0 training in our school about phytomedicine, right? you actively have to seek that out. So I was lucky enough to train under a guy by the name of Andrew Weil, and Andy taught me a lot about herbs and how they act as medicine. So for me, the transition from herbs to oils was not a big leap. For most of us, it's a big, big leap. And most providers really don't have the time because they're trying to keep up on their own specialty and what's going on with the changes there. They have a hard time making that leap. So we don't have a room full of doctors that are trained on oils we're keeping in our back pocket to open clinics. So I would ask this of you, as we open our clinics with doctors that are new to oils, and we put them through a week-long training here, and then we keep bringing them back here to spend time with our providers that do know oils, so that they can get more and more educated in it. If we were to wait to open a clinic until they were fully educated, we'd be waiting 5 to 7 years to do that. If you think about Dr. Hill, who we all know and love, who is the oil guru when it comes to healthcare, the fact of the matter is that 20 years ago, he would have been completely new to all of this as well. So we can't expect to go in and see a Dr. Hill or a Dr. Riggs, and they're new to the oil. So our docs in some locations have some more experience and others don't have a lot of experience. We hope that you will participate in teaching them and helping them learn about the oils as well. Because they're there to learn. I still learn things about oil. It's exciting for me to learn about a new oil that has new chemistry and how to use that in healthcare. So it's pretty exciting.
So are you guys wondering where the locations are of Prime Meridian thus far? We were in Pleasant Grove last week. So that is the location that we toured and the location you're seeing in these photos. There's also, as Dr. Riggs mentioned, St. George, Utah as well, and Phoenix, Arizona, and Nashville, Tennessee. But there are other clinics planned that are going to pop up very soon. And so where can you get more information on this? I will put it right here. This life-changing healthcare, which we can do this together. Let's partner together to find out more about how we can be part of this movement. You can go to pmhclinics.com, which Prime Meridian Health. You can also contact me via either my webpage or just shoot me an email. And I am happy to have a dialogue with you about essential oils or just lifestyle changes. If someone invited you to watch this presentation, connect with them. We really want to be able to partner with you so that we can change the world one drop at a time. So I am so grateful for you guys tuning in today. And I do hope that you reach out to someone who can help you with this oily lifestyle. Thanks so much, you guys. Have a good one.